Hey, this is Dr. Buzz with Buckeye Anti-Aging. I'm here today with Travis. What's up, Trav?
Life's good, man.
And we are going to talk today about hormone replacement, bioidentical hormone replacement, supplementation, and some weight loss stuff. So it's going to be a really exciting show. So we're going to cut the break, and we'll be right back.
Right on. Okay. I forgot to ask. Do you need a water?
No, thank you, brother.
Okay, right over there if you do.
I appreciate
He
you.
needs more caffeine.
Oh,
More caffeine. I'll slow it down for you, Mike.
more caffeine.
Always more caffeine.
Here we
More.
go.
Hey, this is Dr. Buzz with Buckeye Anti-Aging, and I'm here today with Travis, and we're going to talk a little bit about hormones and some weight loss stuff. Travis actually runs the hormone program and weight loss program for Buckeye. What's up, Trev?
Life's good, man. Like I said.
So Travis is in the trenches helping people out day to day. I want to talk a little bit about what's some of the basic things you see and some of the benefits you're seeing, Travis. I mean, we have a lot of patients that come through. We're the leading provider of bioidentical hormone replacement in Columbus, and probably the leading provider of weight loss in Columbus, medical
Absolutely.
weight loss, that is. So we're helping lots and lots of people. But what kind of, I guess the first question I have is, what's a typical patient?
Typical patient. I mean, a typical story I see all the time. A father coming in, and they'll tell me a typical story. Trav, I love my kids very much. They're my world. But when I get home from work, I just feel like sitting there. I don't feel like going out in the backyard passing the ball. The typical, typical wife. Around 35, 40 years old, coming in. I'm depressed. My libido is non-existent. My hair's falling out. I feel weak. I'm putting on weight in my stomach area, which I've never done. That's what I hear a lot is these people.
That happens to guys and girls both, like the stomach area. They're putting weight around their stomach.
Yep, and it's become, obviously from the insulin resistance, right? That's coming from their hormonal deficiency. So all the time people come in with a story, whether it's extreme fatigue, whether it's weight gain, whether it's a lack of sleep, or all three of those things affecting other areas in their life. And every time, 6 months later, if they continue on their treatment and stay dedicated to their part, we hear a completely different story. A completely different story.
Yeah, and a lot of people out there, I think a big mistake people make, I should say, is, they'll listen to the show and they'll wonder, maybe my hormones are messed up, and they'll go to their doctor or primary care, and they'll ask their doc, hey, I was thinking about getting my hormones tested out. What's your thoughts? And the feedback is, oh, you're too young.
Mm-hmm.
You don't need that yet.
Yeah.
And they don't even test them. Or if they test them, they test the wrong things. They'll test like a serum testosterone level, which is inaccurate.
Mm-hmm.
So when your doctor quotes you numbers and they're like 200, 300, 400, 500, up to 1,000, that number is what they call a serum testosterone level, and that's not an accurate gauge of your hormone levels.
Yeah.
It's not an accurate gauge. So you got to test your free testosterone levels. And the other thing you really, really got to watch is the estrogen levels, because in particular with males, we become estrogen dominant as we get older.
Mm-hmm.
And what that means is we produce more estrogen in ratio compared to testosterone, and that's why guys, as they get older, put on more abdominal fat and feel sluggish, and that also leads to heart disease.
Yep.
And lots of other conditions. So, and this is something that I always tell you: the blood work doesn't lie. So if you're suffering with these symptoms, it's really simple. Come to the office. Blood work is actually usually covered by your insurance.
Yep.
And see us, and myself, Dr. Bainan, we're both diplomate trained in anti-aging, so we have the highest level of training on this. This is stuff you don't learn in medical school, So primary care physicians, nothing against them, but they're not really trained on this stuff.
Yeah.
You know what I'm saying? So they look at the basic labs, and that's not the way you do this whole anti-aging thing.
I would say the worst cases I do see, though, are people that have been suffering from, symptoms of hormonal deficiencies that have gone to other doctors and been told, Travis, 3 years ago I went to somebody and I was feeling the exact same way. They ran my blood work and told me I was normal. And normal for, in this, you could take a 33-year-old with this exact same story, but they're putting them on a chart, 20 to 70-year-olds.
Yeah.
So they've been suffering unnecessarily so for the past 3 years because they went to somebody that did not give them the correct information or pull the right panels. So it's an extreme breath of fresh air when we pull that panel and we can finally give that individual answers to what they're feeling. That's the biggest. People come to us with questions that are, obviously deeply needing an
They just
answer.
don't feel good.
100%.
Don't feel good. I had a guy that I talked to yesterday from Toledo. He was referred in from another patient we had in Toledo, which is pretty far, whatever. He's like, I was talking, he's like, I'm hormones. I don't think I need hormones. I've been seeing a hormone doctor for the past 3 years, and
Yep.
I just feel terrible. So can you just look at my blood work? So I was like, yeah, no problem. Send me your blood work. And I checked it out. This guy was on too much testosterone. And people have to understand, it's impossible. Bioidentical hormones don't cause any side effects, but you can overdose or underdose.
Yes.
And this guy was clearly overdosed. He had pretty much 3 times what I would say normal levels should be, 3 times optimal levels. His hematocrit, his blood was really thick, and his estrogen was through the roof. So this guy was running the risk of having heart disease and felt terrible. And and I went back to him. I said, "Listen, you're on too much testosterone, man." So he's gonna end up coming down here, but that's an example of going to a physician who really doesn't specialize this. I think, how often do you get blood work done? He's like, twice a year. You got to do it at least every 20 weeks to regulate this stuff. Yeah, and he'll feel incredible once we balance it out. But this guy here was just totally misdosed. Weren't watching the proper levels. It just doesn't make sense.
This is reminding me of a very specific case. Had a really nice gentleman, about 38 years old, coming in, going through divorce. And we know chemical, physical, emotional stress that rocks on hormones. And he was on a bogus program somewhere else, and the only reason I say that is they're completely mismanaging this guy, and he was suffering for it. He comes in, he said,
not all other programs are bad. I'm not here slamming everybody.
Amen.
Just I want to be clear on that. So there's other people. I've seen people come in that are fine.
Yes.
And if you come to us and you're fine, well, I'll say, if you're happy where you're at, I'm comfortable with the way they manage you, you can stay there if you want. I don't care.
Yeah.
But more times than not, I bet you 75% of the time when they're doing hormones somewhere else, they're getting them done wrong.
You'll love this story. Yeah, and that's the first thing we'll tell them, too. We're here to serve you. If you don't need this, fantastic. It was still an amazing opportunity to meet you. So I meet this guy. He said, Travis, I've been on HRT, or TRT, just testosterone replacement there because they weren't doing it correctly. Right. He said, for 2 years, he said, he got a great referral. He said, that's the only reason I came in, is this person said, no, you don't understand. I feel great. You got to talk to these guys. He said, I've been on it. It's not working. It's not working. So I said, okay, are you on HCG for your natural production?
Which is human chorionic gonadotropin.
Yep, keeps the process alive of creating your own or producing your own testosterone. I said, are you on any HCG? He had no clue what I was talking about.
Yeah, so just to clear up if you're listening here, so if you're a male and you're taking testosterone, whether you're on a gel, which we don't recommend, pellet or injectable, you have to take HCG with it to do it properly, because what happens is testosterone works on a negative feedback. So if you're on any form of testosterone and you don't take HCG with it, your own body will quit producing testosterone. And there's a possibility it would never come back. So the way we treated it at Buckeye is if you have low testosterone, step one is to get your body producing more, and that's what HCG does.
Yep.
And then step two, if you need extra testosterone, we only use bioidentical testosterone, which is the same as your body produces, and we simply supplement what your body already produces and put you to that optimal level, which is what a normal 25 to 30-year-old healthy male is. That's when you fight disease the best, you sleep the best, you have the most mental clarity, your libido is the best. Who doesn't want to feel 25,
yep.
Right?
Yes.
So that's the difference. So that's why HCG is so important, and it's so rarely used. But if you're listening and your doctor has on HCG, hey, that's step one. He might know what they're doing.
Yes, absolutely. So he hadn't even heard of HCG. Additionally, I said, are you on anything to manage your estrogen, or have you ever even been talked to about this? He said,
ding, 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 ding.
Amen. So I'm thinking, okay.
As soon as I talk to someone, if they're not on HCG or not on an estrogen blocker, right away I say, send me your blood work, because that's dangerous.
Yes.
You know what I'm saying? And I tell people, you're better off not doing hormone supplementation than doing it wrong. Yep. I'd rather have you just age and
let your body figure it out.
As much as I believe in it, and I know it helps people live longer and healthier and all that stuff, doing it wrong is dangerous. Mm-hmm. And if you're not on HCG and you don't have an estrogen blocker with your program, you are not doing it correctly, period.
Yep. So, additionally, he says that he's experiencing, he'll feel good for maybe one day, then feels crappy the rest of the days. He's noticing these dips and dives. So, we run blood work. And not to get too specific, but the luteinizing hormone was very clinically low, and that's how we kind of test. If you want to explain that.
Yeah, so luteinizing hormone is the hormone your body secretes to get you to produce more testosterone. So if someone has low luteinizing hormone, that means their body's not trying to produce testosterone. That's a warning.
Yeah. Because
we always want your body to be trying to produce. So if someone comes in and they have a no LH, their body is shut down. And you want to avoid that. Their natural production is done.
Yep. So the LH was almost unreadable. The estrogen was through the roof.
And the estrogen, uncontrolled estrogen, causes extra body fat.
Yes.
Guys don't like estrogen. It's not cool.
No.
Not cool.
No.
Leads to heart disease.
Yes.
And leads to prostate issues.
Yes. And one of this guy's main complaints was he had been gaining weight the past couple months.
Around his belly.
Yes.
I mean, that's what estrogen, we like girls have estrogen because that's why girls are curvy and beautiful, right?
Yes. Yep.
We like it.
Yeah.
Guys, we don't like it.
Yep. So obviously run the blood work. evident that his natural production was shut down. Estrogen was through the roof, and he was on synthetics, so his testosterone was barely touched.
So synthetics you're talking about, so he was not taking bioidentical testosterone.
He
was
on-
taking a drug that mimicked testosterone.
Amen. He was on non-bioidenticals. So
Yeah, and there's a huge difference with that too. So when we talk a lot on the show about bioidentical hormone replacement, and you might be listening, well, what is that? So bioidentical means it's exactly the same molecule your body produces. Identical, bioidentical. A synthetic would be a drug that mimics that. So an example we'll give is with females. This is the example I like to give a lot of times. So we know estrogen is essential for female health. Females have to have it for their libido, to keep their skin and hair pretty. Lots of health benefits, a myriad of health benefits. When a female loses their estrogen decreases, they start having hot flashes. Okay, that's lack of estrogen. If you're having hot flashes, lack of estrogen. So you go to your physician. And they're like, okay, I'm suffering with these hot flashes. They'll say, no problem, we'll put you on estrogen. And they put you on this thing called Premarin. Okay? Premarin is not estrogen. Premarin is a drug that mimics estrogen. Premarin is actually made out of horse urine. And it's 50% E1, which we call old lady estrogen. It causes saggy skin and saggy boobs, which no female I know wants that.
nope.
And the other 50% of Premarin is literally horse estrogen, which your body doesn't recognize. And it causes cancer. And the reason I bring this one up is there's a lot of females out there, and it's just as important, if not more important, for females to be on bioidentical hormone supplementation than males. And I really think every male should be on it too, but females need it more so, because what you got to keep in mind here too is once a female hits menopause, it's PMS every day of the rest of their life. Because that's what PMSing is.
Yes.
It is that fluctuation in hormones. So if you're going through menopause and you don't get on bioidentical hormones, you're PMSing every day of the rest of your life. And it's kind of sad. I was looking at this too. The majority of divorces happen when females hit menopause because it changes them.
My parents included.
And it's sad, and they can't control it because they don't feel good,
Yep.
right? And it's sad. Right in your prime of your life when you should be enjoying yourself and you have a little time for each other, they get this PMS symptoms every single day the rest of their life. And as another side, the other thing that happens is estrogen is essential for their skin and their hair and their curves and everything that we like. Once they quit producing estrogen, the estrogen receptors shut down. And the problem is, if the longer you wait to take bioidentical estrogen to supplement what your body no longer produces, the more those receptors shut down. So what that means is it's essential you get on it right away. Because the longer you wait, you'll never get that back.
Yes.
You know what I'm saying? And that's why, if you look at, it's actually how life works. So as men get older, they produce less testosterone, more estrogen, and girls the opposite. Less estrogen, more testosterone. So that's why older guys start to look like women.
Yep.
Curvy, big bellies, body fat. And older women start to look like males.
You see it all the time.
Yeah. And that's completely preventable, and you'd be crazy not to.
Yes.
Right?
Yeah. You brought up a good point about, when a woman goes through a period, that's what she's experiencing. Her hormones are getting ripped for her, and what you rip from her. And what you often hear in those moments is the phrase, I don't feel like myself.
Right.
And that's how you say it's really not their fault. And it really isn't. They don't feel like themselves because they're not themselves.
Right.
They do not have the tools inside them that make them who they are. They're getting pulled. So these hormonal deficiencies, if you're out there and you're feeling certain ways for the very first time, I'm telling you, get your blood work. And
the blood work never lies.
Blood work. What do you have to lose?
We have
to
people
get
come to
your
our
blood?
office and we check in. Hey, your blood work's fine.
And they live happier
Come
knowing.
see us in a couple years.
100%. And I would say the biggest one to parallel that with, Buzz, you said, what do you hear frequently? Symptoms of depression. I would say every person I've ever sat down, almost every person I've ever sat down with going into symptoms, most of their symptoms were in line with depression. I feel fatigued. I'm tired. I'm irritable. I'm putting on weight. I'm not sleeping well. These are right in line with depression.
Well, the symptoms of low T or hormone suppression and
Yes.
depression are identical. Google it. Symptoms of depression. This would be, difficulty sleeping, lack mental clarity, no energy, feeling lethargy. Those are the same exact symptoms of hormone deficiency. The same exact ones.
Yes.
And what happens time and time and time again, and we've had several guests on the show, you'll go to your doctor and say, hey, listen, I heard the show, or I've been, kind of reading online. A lot of people go online.
Yeah.
I was looking online, and I think I might have hormone problems. And the doctor's like, "No, you're too young. You're 30 years old, or you're 40, or you're 50.
It's the worst.
You can't have that. It sounds like you got depression. So why don't we try this antidepressant medication instead?"
So they're being overly medicated because they're just band-aiding their issue. They're not fixing the root issue, which is hormones, obviously.
And the backstory of that, and the reason I think that the why on that is it's much easier to manage a depression medication case than a hormone case. There's no levels. I mean, you take your antidepressant every day. There's no blood work to follow up.
It's the only variable. Just the
yeah.
medication.
Where a traditional medical practice isn't set up to manage hormone replacement therapy, because to do it properly, you got to do blood work at 1 month every 20 weeks. You got to review the file. You got to change dosages. A regular medical practice just can't do it. They're not set up for that.
Yeah.
They're set up. It's a triage. You go there. For the cold, the flu, your heart. They're to get you to other providers.
Yes.
They're not there to manage a hormone replacement case. They're just not set up for it. You know what I'm saying?
100%.
So very essential. And there's an epidemic of people taking antidepressants. And the other thing people have to realize, and they don't, antidepressants were designed for short-term use only. There's no antidepressant on the market that's ever had long-term case studies on what's going to happen long-term.
Yeah.
And you have 25 million Americans on antidepressants, and the majority of them can't get off now.
Yep, they're hooked.
They're hooked. And we don't know the long-term effects. Is it going to cause Alzheimer's disease, Parkinson's? Like we don't know what's going to happen. It's scary, right?
Absolutely.
But antidepressants were developed. Something happens, your dog dies, you get fired, you break up with your girlfriend or whatever. You take the antidepressant to get you to a moment in your life. They were never designed as a way of life.
Yeah.
You know what I'm saying?
Anytime somebody brings up, their story on with antidepressants when they come in, their story is always, I felt great for a second, and then I felt right back into the same trap. When you
didn't fix the problem.
100%. When you talk to somebody on hormones, they say, I came in, I had issues, and I've never been better. And we're talking 2-3 years down the road. Right?
Yeah, our customer satisfaction on hormone replacement. I mean, I'm not trying to brag, but I don't know if I've ever had a patient.
Yeah.
I'm sure one. I just don't know that has said they're unhappy, because it's night and day. It's not like what I want you to realize. This is not like you're taking a vitamin. We're not pushing vitamins here. Everyone knows you probably should take vitamin C and fish oil. But you take this. You don't feel it, right? You just take it because someone told you it's good for you. And it's whatever. Or even protein. You feel better and take protein. I don't know, whatever. Hormones are that's a game changer. When you're on bioidentical hormone replacement therapy, and when you need it and it's done properly, it will change your life
without question.
You'll look back and say, why the hell did I wait so long?
Literally, your life change is right on the other side of a blood work. And not to sound, too, gimmicky with that, but getting a blood work done changed my life.
And you also have to understand, a lot of people, I think, in the back of their head say, well, my parents didn't do it, and this is some new thing, and we really probably don't need it. What you don't understand is hormone levels, and this is proven clinically, right? Hormones for males and females is more messed up now than ever. And it starts out, and if you doubt this, go to my kids, 12 years old, you go to school. Girls are developing faster.
Yes.
And the same thing with boys. It's all the hormones in the meats. It's in the plastics we eat. Society's not like it used to be.
No.
And that's why people's hormones, when you get hormones younger as a child, when you get older, you burn your adrenals out and you don't produce when you get older. So we have lots of patients. We've had patients in there, and the other thing we should talk about is, we'll get into it, is if you've had a lot of concussions, traumatic brain stuff, we had a person come in this week, he's in his 20s. I don't know what he was.
He was 19.
19.
Yeah.
No testosterone.
Almost non-existent.
And when I'm looking at this guy, it could make sense, and I actually missed it. I was talking to him, and I was like, we'll try some HCG to get your own production going, whatever. And I think he came back and talked, and by the way, he had a real bad auto accident. Right. And had a traumatic brain injury. And if you've had a traumatic brain injury, your hormones, there's a good chance they're done.
100%.
So there's lots of factors out there: concussions, brain injuries, the meats we eat, the plastics we eat out of. These all contribute to our hormone insufficiencies and a general down regulation of how we feel.
Yeah, obviously we can't name names, but a particular NFL player that's one of our patients. He had a traumatic brain injury, from just years of playing. He got that treated, the right way. And then he started our program. He said he wasn't 100%, but he called me the other day. He said, Travis, treating my traumatic brain injury, that got me to 90%. Visiting you guys got me to 100%. And I think that's a lot of our stories, and that's something that's been looked over. Think of how many of you out there have simply played pee-wee football and were having intense head-on collisions at a very young age.
Yeah.
So
And it goes back to kids are bigger and stronger now too.
sports are getting more serious.
Yeah, I mean, when I was a kid, you play football during football season, basketball during basketball season, wrestle. These kids, there's people that train year round for football now,
Oh yeah,
and they're bigger, stronger, faster, and the velocity
yeah,
is much greater. So because of that, they're more likely to have these type of injuries as
absolutely.
a young person. And then what happens, and they get to college and they can't focus. I've had several kids that are in college that are struggling miserably because they can't focus. You do their hormones, and the hormones are a mess because of stuff that happened. That, they were really active in sports when they were younger.
Yeah,
So once again, we circle back, get your blood work done, and if your hormones are fine, don't worry about it. But the blood work doesn't lie.
that's simple. If you're in any position at all whatsoever, and you do not know why you feel the way you feel, you have to get your blood work done. And any doctor who is willing to work off of blood work is a doctor that's willing to put their neck on the line. If they give you medications, they do not need blood work. It's not going to make a difference in your in your body. Sorry. If somebody's working off blood work, you're going to see changes. They're looking. You can marginalize that. You can see improvements with your testosterone. You can see improvements with managing your estrogen. You cannot do that with just antidepressants.
Right. And as I said, and if you're on antidepressants, short-term use only. I'm not antidepressant
For sure.
but they weren't designed for to take for the rest of your life.
100%.
And you have to wonder. There's more Alzheimer's and Parkinson's than ever. You're taking a medication that alters brain chemistry. Those are brain diseases. There's got to be a correlation. And another big thing you see is a lot of people don't understand. So cholesterol. And the cholesterol's got this really bad. When you say cholesterol, what do cholesterol? You want cholesterol. Cholesterol is how your body heals. Cholesterol converts into testosterone.
Isn't it a precursor, right?
Yeah, 100%. So if you have low testosterone, guess what a symptom will be?
What's that?
High cholesterol.
See it all the time.
So you go to your doctor and your cholesterol's high, and it's like, your cholesterol's really high. We got to get that down, so we're going to put you on a statin. Okay.
Yep.
Statins wipe out your cholesterol, but guess what else they wipe out?
What's that?
All your hormones.
There you go.
So the very thing you need to heal cholesterol, they wipe out. And you'll never talk to somebody on statins that feels good.
Never.
And if you ask them, hey, when you start taking the statins, how do you feel? Oh, I feel terrible. I have aches and pains and no energy. Guess what? Because you have no hormones now.
100%.
And guess what? Now they're saying that statins lead to Alzheimer's.
Yep.
Well, guess what? If you can't fight inflammation, Alzheimer's is an inflammatory brain disease. It's a no-brainer. Connect the dots.
100%.
So am I advising you to get off your statins? No, but I mean, if you're on a statin, get your blood work done and fix your testosterone, and guess what? Your cholesterol is going to get fixed.
Yep. You said it, temporary use only. We're not saying that, if you're going through excruciating pain and had a horrible surgery, yeah, a painkiller is going to help and it's necessary. But when you're 3 months down the road and you still have the inflammation, I'm telling you, it's your hormones.
Yeah, 100%. Yeah, I was doing a stem cell lecture yesterday, and when people come up to me after a stem cell lecture, like, can we put stem cells in every joint? My knees, my hands, my shoulders. I stopped right there. I said, get your blood work done, because if you don't fix your hormones, stem cells won't even work.
Yeah.
Right. So let's get your hormones balanced out, and then once your hormones are balanced, guess what? Most of your pain will probably be gone. And if there's something left, then we can maybe address it with stem cells or ozone or one of the other regenerative medicine procedures we do. But if you have pain, fibromyalgia,
100%.
pain everywhere, get your hormones fixed.
Absolutely.
It all circles back. And what hormones do, in the simplest terms, hormones are how your cells communicate. It's a communication system of your cells. So picture, you can have a bunch of 1,000 Navy SEALs. They probably never have 1,000 together. We'll say 100 Navy SEALs going to combat. Imagine if they couldn't communicate. How effective would they be?
Not at all.
That's the same thing with your body. If you don't have hormones, I don't care what kind of stem cells, what type of therapies you do. If your cells can't communicate, nothing works.
Absolutely.
Nothing works.
You said it across the board. Weight loss, sleep. I mean, it's not going to matter.
Because hormones, what they do is that's a communication between your cells. No hormones, no communication with your cells. Discommunication, we call that. And things break down. That's what aging is.
Yep.
But you completely reverse that by coming and get your blood work done and do the bioidentical hormones. And it's a game changer.
Absolutely.
For sure. Anything you want to add to this? So just real quick. So if someone's listening to this and they're finally taking the step and do blood work, how do they do it?
So you just call in 1-800. What is it? The 614. I think we'll get that before the end.
Good.
Exactly the exact number on
Or
that.
just go to the website.
Yeah, 100%. Go to the website, Buckeye Anti-Aging and Aesthetics,
Mm-hmm.
Buckeye Physical Medicine in the Gahanna location. But like I said, your life change could be right at the end of at the other end of a blood work. You come in and get checked out. You have nothing to lose. We're not there to be pushy. We're there to serve.
Yeah. Well, Travis, thanks for coming on. I really appreciate it. This is Dr. Buzz. Until next time.